Hi, my name is Zachary Town, and as part of the Health Equity curriculum, we'll be discussing techniques used to counsel patients on healthy behaviors. At the onset, I want to say that it's one thing to learn how to counsel a patient, but another thing to master the techniques. You'll need plenty of practice, and I hope today is the first step. At the end of the session, you'll be able to summarize and apply the techniques to various clinical settings. We'll first start with discussing model change and development, and from there we'll go over the 5 A's, frames, and motivational interviewing. Now, it might surprise you to hear that only about 20% of a person's health is accounted for with just good medical care and their genetics. You may see your interactions in the clinic and the hospital as the most important aspects of a person's health, but a lot of life occurs outside of the office. The remaining 80% of a person's health is a product of their environment and include factors like their health behaviors and socioeconomic factors that we refer to as social determinants of health. Considering that 30% of our patients' health are the behaviors we can modify, we need to be experts in providing them advice and support that see them through these changes. Counseling is a skill that healthcare professionals can use to help our patients modify their behaviors, addressing the 30% of those social determinants of health. As compared to the treatment of physical ailments, counseling is the assistance or guidance we can provide to the patients. Counseling is an essential part of our profession and something important to master. Yet only a third of primary care physicians say they have expertise. So it's clear that we need the practice if we're going to help our patients. On this slide are the 3 models of counseling that we will be discussing today, along with the trans-theoretical model, aka the stages of change. The models will be discussed throughout the presentation, but this slide points out where the models are best utilized. As you can see, there are considerable overlaps between their applications. However, the United States Preventative Services Task Force has identified the 5 A's as effective for reducing smoking and alcohol use, the frames as effective for reducing alcohol-related risk behavior and reduced cannabis use, and then finally, motivational interviewing is associated with decreased weight, blood pressure, and alcohol use. Before we go through the details of each method, we need to meet the people where they're at. This might be one of the most important interactions we have with patients when beginning to address modifiable health behaviors. No piece of advice will be one size fits all. It won't be helpful to the same patient throughout their process of changing behaviors. I don't think it's hard to imagine that our patients would quickly get frustrated with us if every time we counseled smoking cessation, we all advised that you should smoke exactly 0 cigarettes a day. It lessens your chance of developing cancer. It's time to quit. A lot of patients would feel unprepared to go through the daily life without tobacco. Some will just quit and need help with their cravings, while others may not see their use as problematic. So with that in mind, we can use a trans-theoretical model to help identify the current mindset of the patient and provide counseling that will best address their current needs. This particular framework is used for many behaviors, including substance use disorders, nutrition, exercise, mental health, and medication adherence. The trans-theoretical model has 5 stages to it that reflect a person's change in mindset as the behavior changes. Take a quick moment to notice that 3 out of the 5 stages occur before any actual change is made. I think this is important to realize. If we want our actions to be consistent and behaviors to be truly modified, then we benefit from the support and encouragement and need time to prepare and adapt. It is also important to point out that once you achieve the goal, the effort's not over. You need to maintain the behavior. Along with the trans-theoretical model are the processes of change, specific steps and skills the patient can employ as they progress through the steps towards maintenance. This slide and the following slide will discuss these changes in detail. While understanding these processes of change can assist you with your care of patients, if they are not crucial to the objectives of today's lesson, feel free to view these next 2 slides at your own pace. This slide helps to define the processes of change and demonstrates how this model can apply to a broad assortment of topics, in this case, modifying behaviors to reduce climate change. Pre-contemplation is the first stage of the trans theoretical model and is exemplified by the patient's lack of plans to change the health-related behavior or the potential opposition to change. At this point, it is important to raise awareness of the behavior and to point out that the patient has agency in this behavior. Some ways to initiate the conversation include: is it okay if I talk about your smoking? What are your thoughts about your smoking? Has your substance use been a problem to you or anyone else in your life? You can use these to get the conversation started and to have the patient reflect. Contemplation is the first step towards change. The patient will likely state their ambivalence towards the change, and this presents a great opportunity to help them see the increasing positives towards changing while decreasing the perceived negatives of changing their behavior. The patient may not have specific plans to change, but the patient is considering change in general. The conversation here is centered on the patient's current thoughts and attitudes towards change. You can use certain lines like, what do you see as the pros and cons of continuing to smoke? What do you think the hardest thing would be about stopping your smoking? Or what do you like about smoking marijuana? At the preparation stage, the patient is ready to change, and you can work with the patient to develop a clear plan. Focus should be placed on preparing for challenges and triggers while changing their daily environment to help. Think of things like removing ashtrays or lighters from the house, or not going to happy hours after work. We want to set them up for success and provide them with whatever resources we can. Consider lines like, how can I help you be successful? What do you see as the major challenges once you quit? And what could happen that might make you start smoking again? Going through these will help the patient feel prepared and ready for action. All right, it's action time. The patient has started that new behavior change. At this point, reinforce their success. Let them know that the change is due to their ability to control and improve themselves. It's important to have the patient reflect and consider unanticipated challenges to make them resistant to those challenges. Consider lines like, you've done so well in cutting down on your drinking. Have them reflect by saying, what have been the major challenges in staying away from the cigarettes? Or, have there been any situations in which you were tempted to drink? How did you handle those urges? Things like that will help them both plan to be successful going forwards and give them that motivation to continue. Maintenance is the final stage, and hopefully permanent. At this point, the patient has been successful in changing their behavior, but they might have had a few lapses along the way. You can help them by normalizing the lapse, pointing out that this may happen from time to time, and that they're not a failure for having a lapse. In fact, you can highlight that the person was able to right themselves and prevent the lapse from becoming a total relapse or going all the way back to the beginning. They're in control, and they have a lot of tools to help them going. All you need to do is to support them. So an additional way to counsel patients is known as the 5 A's. These are thought to be practical, action-oriented steps that identify and intervene around behavioral health issue. And they break down into, surprisingly, 5 A's. The first one being asking the patient about a particular health behavior. From that, you then advise based off standards and guidelines, and then you assess the willingness of the patient to change that behavior today. Depending on how willing they are, you then assist them. You provide some skills, maybe medications, referrals, things that they can use every day to help change that behavior. And then, once you've gone through all that, you arrange a follow-up with the patient, typically in a few weeks, and say, let's check in again, let's see how things are going, and then take it from there. So FRAMES is a counseling method that ties patient-centered care with motivational interviewing and empirical treatment options. Studies have shown that FRAMES is effective in reducing excessive alcohol consumption and cannabis usage. The next few slides will walk through the components of FRAMES listed below. First, provide information on the health behavior while connecting this to the person's personal health. You can then elicit the person's thoughts on their behavior and the information. During this, it is important to emphasize that the patient is responsible for making the change. You can support them and provide guidance along the way, but they must make the change for themselves. While motivated to change, provide them with neutral advice to change based off objective standards provided by organizations like the USPSTF. As you recommend change to the patient, provide them with a menu of options. Not every option will fit the patient's lifestyle, so provide the menu to the patients and ask what seems appropriate to the patient. Throughout the entire process, make sure to maintain an empathetic approach to the patient. You want to support them in their decisions with a non-judgmental, accepting approach, while making it clear that you're listening to the patient's wants, needs, and thoughts. Likewise, offer genuine and sincere support to the patient. Be their biggest cheerleader as they undergo their behavioral change. So motivational interviewing is the last method we'll go through today. It's a great skill that can be applied to a wide range of behaviors, including medication adherence, dietary change, and substance use. It was developed from the observations of substance use counselors and focuses on empathy, understanding, and increasing the patient's motivation to change. There are three broad stages to this technique, including the establishment of rapport, developing discrepancies, and establishing a plan for the patient. Motivational interviewing requires a lot of practice to master, with a mean of 9 hours, while basic skills can be achieved in 2 hours. In the primary care setting, though, 15 to 20-minute sessions have been proven to help patients begin to change. So in the spirit of needing to practice these skills, resources have been posting in the syllabus, and I highly recommend you check them out. During this first phase of building rapport with the patient and evaluating their values, we can utilize the acronym OARS. This includes open-ended questions to help determine their values and to set an agenda, affirmations that validate the patient's interest and emphasize their strengths and successes, reflections, so you can let them know they're being heard and supported, and then summarizations. Tie together the discussion and set the stage for the next step. You can use lines like, "What brings you in today?" Or "How do you view your drinking?" "It seems great that you're thinking about changing after 10 years of smoking." Reflections would be, "It seems like you don't like how you act during a night of drinking or how you feel in the morning after." And a summarization could be, "You're worried about your drinking may be interfering with your family life, and you've tried quitting before. You feel more prepared this time around and are motivated to spend more time with your family." The next step is to develop discrepancies between their behavior and their values. At this point, we want to highlight the patient's sense of control in addressing the health risk behavior, and we can do this by asking their permission to provide information to them. It is important to maintain a neutral tone so the patient does not feel judged for their behavior. And once that information has been shared, you want to follow up with questions to make sure they understand the information you provided, and you can start to develop that discrepancy. Finally, you can tie in the information to the specific health risk behavior or symptoms the patient may experience. This way, the discrepancy should urge the patient to change their behaviors to better align with their values that you previously established with them. So finally, the patient is ready for a change, but you're not going to let them just leave without having a good plan. The first step to this good plan is to reaffirm that you and the patient are working towards the same goal, and that it's their goal. From there, you want to continue to increase their agency and self-efficacy by making sure that they have input. Ask them how they think they can change. From there, and once you've reflected on their input, ask if the patient wants information on different interventions or treatments. The patient may or may not have an idea of how to change, but you can always ask them if they want more information. And finally, if they want, you can provide a menu of options and then specifically recommend treatments based on their values and lifestyle. So hopefully this video has helped you walk through a few different techniques of counseling. Be sure to go through the other resources to see the techniques in practice.